Hi everyone, welcome to our special webinar on endometriosis. I'm Dr. Shreya Soni and I'm here with my friends and colleagues, Dr. Maryellen Tedeschi and Dr. Molly Sears, to talk about my favorite condition to help women heal from, endometriosis. So fun fact, so if you go back to the past slide, since 1980, yellow has been universally known to be the color for endometriosis awareness. And this is extremely important because on average, it can take up to 10 years to get this diagnosis. And meanwhile, you have these aberrant, which are abnormal endometrial cells growing in other organs for women. They can travel to the diaphragm, they can travel to the low back and cause this debilitating type of pain. So endometriosis awareness is especially important. So I have had a lot of fun treating patients with endometriosis, and I have a special interest in it because these are incredible women that I see change the world after having experienced some of the most debilitating pain imaginable. So these next slides are developed straight from patients. So girls with endometriosis, they do get pregnant, even though fertility can be impaired. It's still possible to get pregnant. I've seen that with my patients. They can run businesses, even though they're living with this chronic debilitating pain. And inevitably, they change the world because when you have something like endometriosis, if you're not healing from the cause, this tissue does grow back. So we're going to talk about healing from the cause here, and that involves making lifestyle changes, environmental changes that have a profound impact on the world around you. So this is a kudos to all the women with endometriosis out there fighting this disease, getting recognition, and changing the world.
Absolutely. And we are here to help you not only survive, but thrive with endometriosis. And naturopathic doctors have, I might be biased, but the best tools available to really help you get on that path to healing overall. So what is endometriosis? So as Dr. Shreya briefly mentioned, it is a presence and growth of endometrial tissue that normally lines your uterus, that endometrium. And it is located outside of the uterus in the case of endometriosis. So we can have it growing on the ovaries, the fallopian tubes, the peritoneum. We can have it go into your abdominal cavity, the diaphragm, even your bowel and bladder. So really, from a functional standpoint, it's estrogen dependent. So we're going to talk about hormones in a couple slides, but often we don't really think to connect the dots that it is actually an inflammatory and immune mediated disease. And it does affect 1 in 10 or 10% of women. So symptoms. Pain, you'll see in caps locks there because it is truly a chronic pain disease. So not only do you have those menstrual cramps, debilitating menstrual pain, but you're getting abdominal, back, pelvic pain, pain with intercourse, pain with bowel movements or urination. There's really no limit to where you can experience this pain because of those endometrial tissue that are growing in other areas in your body. We can get severe PMS symptoms, heavy menstrual bleeding. We can get constipation. A swollen abdomen is another common one. A lot of gas, insomnia, fatigue.
So the common term you will hear in the community, they say endobelly.
Mm-hmm.
So it's bloating to the point where you look like you're pregnant when you're having a flare of endometriosis.
Exactly.
And you can have all or some of those symptoms just because, again, it's growing so individualized in your body. So the symptoms are going to be dependent on where that tissue is growing.
Exactly. And the diagnosis, so as we briefly mentioned, and as you can see by those symptoms on the previous slide, there's overlap of symptoms with a lot of other conditions that can truly lead to a misdiagnosis. And it can take up to 15 years in North America for you to get a diagnosis as a woman. And to give you an idea of how common pain is, severe pain and cramping is estimated to affect 6.5 million women in the United States and Canada alone. And I know we've talked about this before, but just because it's a common symptom affecting a lot of women does not mean that it is normal. And women with endometriosis, they're more likely to also receive a diagnosis of IBS or irritable bowel syndrome, 6 times more likely to have been diagnosed with PID or pelvic inflammatory disease in the past as well. So once again, that's due to the overlap in symptoms that we see. In order to get that diagnosis, a laparoscopy is the gold standard. There are some helpful labs that can help us identify if endometriosis is at the culprit of your symptoms if you're going through the diagnostic process. So getting our hormones tested, CRP, C-reactive protein, which is a measure of inflammation, CA-125, and there are future tests in the works too that hopefully will shed some more light on endometriosis aside from laparoscopy. And family history too. So when there is a family history of endometriosis, you're 3 times more likely to get that diagnosis.
Yeah, and I'll just add, the reason family history is so important here is because your life as an egg, it actually started in your mother's ovary before your mother was even born. So you actually, like, it stems from your grandma. So all of those exposures add up and end up influencing you. So it is something that digging into family history is very helpful for in getting a likely diagnosis.
Absolutely. So we're going to talk about the causes, the root causes, some of the patterns that we see with endometriosis, and I've lumped them into 3 general categories. So genetics, hormones, and immune. So if we start off with genetics, we know that alterations in detoxification enzymes affecting your hormone metabolism, tumor suppressor genes, and other genetic factors may be involved in endometriosis. And I know Dr. Shreya has some more info about the specific genes that can be.
So we're getting more and more information on genes. So blaming things on genes is no longer enough. Like, there's a whole field of epigenetics where you can manipulate the expression of genes. And this is especially important in endometriosis. The way you can manipulate the expression here is by looking at clearing out some of your environmental toxins and cleaning up these dirty genes. So environmental toxins like PCBs, phthalates, and BPA. So these are found in plastics, fragrances, makeup products. They affect 5 common genes involved in estrogen metabolism, and these are CYP19A1, EGFR, epidermal growth factor, ESR2, estrogen receptor 2, IGF-1, which is insulin-like growth factor. So these are just to name a few, and all of these genes, they are modified in breast tumors, uterine tumor tissues, and endometriosis lesions. So these genes are all estrogen responsive, and they're influenced by these environmental exposures that you can help your body cope with and remove from your environment.
Genetics is a really cool and ever-changing field that I know Dr. Molly, Dr. Shreya, and I share a lot of passion and interest in. So this is definitely a topic that we're going to dive in one of our future videos for sure. So then if we look at our hormones, so when we're dealing with endometriosis, it's truly an issue with altered metabolism of our hormones, specifically estrogen. So we can have alterations in the normal estrogen metabolism in our body and the progesterone sensitivity in the tissues of the endometrial lining. So endometriosis is an inflammatory condition which can lead to estrogen dominance, but estrogen dominance can also aggravate the immune system and then lead to inflammation. So it's a vicious cycle, and we can't just blame it on estrogen dominance at this point. There's so much more that goes beyond just blaming it on hormones. There's truly all of those factors that are involved. And as Dr. Shreya mentioned, those endocrine disrupting chemicals play a huge role in how our body is responding to and metabolizing and detoxing our hormones. So it's just certainly something to clean up and to get a hold on for sure. And I know that Shreya is going to talk about this in a couple slides, right?
Yeah. Estrogen gets a bad rep these days.
Yeah.
For being proliferative, but it's actually like wonderfully immune supportive. It has a lot of benefits for women. It's when we're exposed to these chemicals that are estrogen mimicking. So things like plastics, that they're affecting the same receptors as estrogen and causing some of these really bad side effects and long-term consequences, including cancer.
Exactly. So that's why when we're talking about hormones, it's important to be mindful of our environment truly, because that's what's going to dictate how our body's responding to these things. And I added this slide here. I know we've talked about this estrogen metabolism in the past in one of our webinars, but things that we like to look at as naturopathic doctors, we like to run comprehensive hormone tests such as the Dutch, or in Canada, the Comprehensive Hormone Insights Test by RMA. And we like to see how our body is metabolizing and detoxifying our estrogens. It can give us some great insight as to what's going on. And there is a favorable estrogen that we prefer our body to make, which is the 2-OH form. So things that can help support healthy estrogen metabolism, which we may consider in women with endometriosis, are things like DIM, I3C, calcium D-glucarate, vitamin B6, magnesium, and methylation support too. So whether that's methylcobalamin or vitamin B12 or folate.
Yeah, so now we're going to dive into endometriosis and our immune system, because as both Dr. Shreya and Dr. Maryellen mentioned, it's more of an immune condition, although has chronically been discussed as primarily a hormonal condition. It's also treated often as a hormonal condition conventionally, and so it's really important to use both conventional and naturopathic treatments to give you the treatment you need to be well-rounded. So specifically, those with endo are said to be in a Th2 dominant activation in regard to their immune system. So if you go on to the next slide and you look at this diagram, oh, you're there, sorry. Then you can see here this is our immune system, and it can be broken down into a Th1 or a Th2 dominant side, and the T regulatory cells in the middle are going to help us keep that balanced. Generally, we see Th1 being more of autoimmune conditions and Th2 being more allergies, atopy, etc. But endometriosis falls over here as well. So our immune system has cells that act like vacuums to clean up the endo cells, and in our endometrial cells, and in endometriosis, those aren't functioning properly. So that's our first problem. Then we see the Th2 dominance take over, which is going to result in an increase in antibodies, inflammation, kind of mess up a lot of our local signaling that we have happening there. And that can definitely go beyond just the abdominal cavity, but that's most commonly seen. And then this results in our endo patients presenting with progesterone resistance. So their serum levels of progesterone may look normal, but they might not be getting any of the benefits of that progesterone binding and exhibiting its effects that we want it to. So that's where we start to see the hormonal imbalance happen. And as we become more progesterone deficient, we become more functionally estrogen dominant. And so that's, again, when a lot of those symptoms start to show themselves. Besides just the chronic inflammation causing the progesterone resistance, we also see environmental toxins, genetic factors, in utero exposures, all those things that Dr. Maryellen and Dr. Shreya were talking about can play a role. So again, it's just this cycle of more inflammation, more progesterone resistance, more inflammation, more progesterone resistance. But if we go on to the next slide, we'll kind of look at what this all results in. So the overall results, our patients get left in a state of high inflammation. So like all of our treatments, we're going to try to diversify our treatment to hit as many systems as we can. So this includes managing our inflammatory exposures. Dialing in on your gut health is going to decrease systemic inflammation greatly. And then key supplements that I think Dr. Shreya is going to dive in more depth to include things like NAC, melatonin, green tea, resveratrol, pycnolol, key vitamins C and D. And we're going to kind of look specifically at NAC right now. So NAC has some really, really cool research, and Dr. Shreya is going to get into the dosing. But some of the benefits that have been seen is decreased sizes of lesions, reduced need for surgery, increased pregnancy outcomes, and decreased pain in our patients. So that's really cool. this study was done originally in Italy, and a significant number of the patients that were participating in the study actually canceled their surgery. So that's awesome.
I love this study because it's really great indicative of support with fertility. And then with endometriosis treatments, it's important to think about your strategy. And so why is something like NAC helpful? It's a key antioxidant that supports liver health and detox pathways. So that is why we might be seeing these beneficial results in patients. And then you mentioned dosing. The study had a really interesting dosing where it was 600 milligrams 3 times a day for 3 days a week only. And the researchers hypothesized that taking it 3 days a week helps your body maintain that high level of NAC on the other days. So those are just some points to consider. Another thing is with any supplement, there's always going to be side effects. Please talk to your doctor. So NAC, for example, thins the mucous membranes. And so if you're taking a lot of NAC, you might notice the nosebleeds if you're taking it when you don't need it.
Yeah,
Great.
I like how you mentioned that it's safe in pregnancy, because that is one of our supplements that, again, if you're working with your doctor, can be implemented safely through pregnancy and help our endo patients.
For sure.
Yeah.
Yeah, so treatments, there are so many treatments for endometriosis supplement wise. So sometimes I'll see patients with a list of, 20 supplements. And that's not necessarily treating the cause. It's in some ways it's band-aiding. So we do want to have a strategy individual to each patient and understand why we're doing certain things. So for example, why are you vitamin D deficient? Are you getting the sunlight you need? Are you spending more time indoors? Making those lifestyle changes will be very important. For endo patients, like why would one be deficient in B complex and need some of these B vitamins cited here in these treatments, like niacin, B6? One of the common reasons could be that, hey, you have endometriosis, so you're taking a lot of painkillers that erode your intestinal lining, and it's reducing your absorption of these nutrients. Or it is that you're bloated, and so you're not absorbing some of these nutrients. And so dealing with the cause of why a person needs all of these supplements is going to be really important. Helping heal the intestinal lining, if that's involved for you, it's going to help treat it at a cause level, so that there can be a time in your life where you don't need to be taking 10 to 20 different supplements. So this list is straight from my website, from a blog article called What You Need to Know About Endometriosis. So yeah, you can head over to Dr.Soni, S-O-N for Nancy, I for India.com to read the full article. But it's important to work with a provider and have a strategy in place. And again, nothing should be taken long-term. Yeah.
And I love that you brought up the fact about not being able to absorb these nutrients and key vitamins if we are having symptoms of intestinal erosion or a lot of gut symptoms. And Dr. Molly touched on this too. And I clinically see a lot of correlation with IBS and endometriosis in my patients. So even before my patients have an official diagnosis of endo, they're usually always coming in with gut issues too.
And with things like IBS, I see a lot of people on super strict diets, and that can be a source of stress and not necessarily help you with the cause of why this is happening. So something like IBS and endometriosis, having mindful eating practices where you're taking advantage of gratitude with your meal, you're being present in your environment, chewing things 30 times before swallowing, having a whole ritual of eating, that's going to help you produce the digestive enzymes you need to absorb these nutrients naturally, and also kick you out of the fight or flight sympathetic state and put you into the more relaxing parasympathetic state that's associated with digesting well, not having symptoms of IBS, and healing.
Exactly.
Yeah, so this is what I just mentioned, treating the cause. So this is my personal philosophy on treating endometriosis. It's important to look at the underlying conditions. Like Maryellen mentioned, they can be infection, inflammation, trauma, environmental toxins, and it's going to be unique to the person. We might be addressing one of these at a time, or we might be addressing all of them at the same time. So there are stages to treatment, and it's important to have a plan. So this will be the phase where I'm supporting my immune system. This will be the phase where I'm supporting the liver. That's how I tend to work with patients. So yeah, nutrition is a big topic in endometriosis because there are studies that show eating less inflammatory foods, sometimes even animal meats, are associated with less pain during your period. But again, this is very person specific because I also see people with endometriosis, women with endometriosis, being deficient in iron. And so I'm not going to tell you to keep out your red meat if you're deficient in iron. So please be cautious with what nutrition recommendations you take. But the basics, and we've talked about these in our past presentation, omega-3 is very anti-inflammatory. An American diet is typically rich in omega-6, which is pro-inflammatory, disrupts your hormones, and increases your circulating levels of estrogen, which is what we're trying to combat in endometriosis. And then increasing fiber that helps lower your plasma estrogen by helping excretion. So making sure you have daily bowel movements is really the best way to get rid of your excess estrogen and to detox from environmental toxins. Then increasing your intake of organic fruits and vegetables. So these are less likely to have pesticides, which are hormone disrupting in the first place, but also they're antioxidant, anti-inflammatory. They have things like quercetin, which will help reduce pain for you. And then antioxidant superfoods. So this includes matcha, EGCG. So these are supplements, some of the supplements we use with patients, but you can get it through diet. An ORAC value is a scale that tells you how active something is. Top antioxidants, espresso is one of those. And then your berries are all antioxidant superfoods. Do you guys have any favorite antioxidant superfoods? Matcha is one of my top favorites too. Yeah.
Matcha, I love the berries.
They're great too.
Mm-hmm.
Yeah. In having some prebiotic and probiotic foods, we'd talked about your gut microbiome and feeding the healthy bacteria. It's called your estrobolome. That's the word for your gut microbiome because it's so involved in producing the right type of estrogen. So modifying your diet so that you're eating things like kombucha, sauerkraut, pickles. These are part of our traditional diets. So diets in Europe, diets in India, even Korean food, you'll get 20 different types of fermented food with your meal. So it's important to start making those shifts and start eating that way so that you're eating aligned with what you need.
Yeah, bitter foods and bitter herbs too.
Yeah, that's something.
That's something that we see a lot in Europe and Southeast Asia and things. And that's because those bitter herbs help to stimulate your digestive enzymes and allow you to properly digest your food.
Yeah, they support the liver,
Mm-hmm.
and the liver is involved with clearing out your environmental toxins. It's involved with metabolizing estrogen.
Mm-hmm.
Bitter foods are really wonderful. For Americans, the main bitter that we have is coffee. So coffee helps with certain enzymes in detoxing, but it's also something that, people end up removing with endometriosis because it has some estrogenic effects. So it is very person to person. But yeah, our American diet is devoid of some of these bitter herbs.
Mm-hmm.
And then trans fats are definitely associated with increased risk of estrogen. So please cut out your junk food, your processed foods. Those are the basics. All right, so as we talked about earlier, there are studies showing that exposure to environmental toxins increases your risk of developing endometriosis. And the specific environmental toxins that have been studied are BPA, dioxins, pesticides, and heavy metals. So BPAs in your plastics, dioxins, and PCBs, they can be in your fragrances, even your self-care products. So it's going to be important. It's possible to test these and see if you're exposing yourself to it. We talked about PCOS in the past. Your exposure to BPA can influence your child's ability to get PCOS. These stick around in our blood and it matters. So the way I treat this with patients is I do an environmental exposure assessment. Mold is another thing that's on the list that needs to be removed if it's in your environment. And we talk about starting to make the changes to take these out of your environment. And then if necessary, which you can identify through testing, there is urine testing to see your exposure to BPA, to see your exposure to heavy metals. So if indicated, we will start supporting detox pathways. All right, and these are just another list of the things to be cautious of. It's important to start reading your ingredients and understanding what is written on the label. So anything you put on your skin goes right into your bloodstream. Your body doesn't have a chance to break it down, to detox it. So it's really important that anything you put on your skin is actually something you're able to eat. That's how healthy it should be. Versus when you eat something, your gut has a chance to digest it, break it down. The liver gets a chance to metabolize it. If it's going right in your blood, it's getting right into your endocrine system and it's affecting your hormones. So please be cautious with any of these items in your lifestyle and start making the changes here. Infection is a personal favorite of mine in addressing an endometriosis. And this started for me because a lot of my patients with endometriosis would get flu-like symptoms around their period. So they would have swollen lymph nodes, they would get fatigue, malaise. And so then I began checking for certain viruses like Epstein-Barr virus and seeing how high the antibody load was. Because so Epstein-Barr virus is known as mono, the kissing disease. 9 out of 10 Americans will test positive for having it. But certain people will actually have a very high antibody load to it with IgM, IgG titers, and that can indicate that this virus has been reactivated. So I do think viruses have a role in proliferating, causing the proliferation involved in endometriosis. And it's important to begin to support the immune system, which starts in your gut. And it's also addressed by having healthy boundaries. Your skin, your gut, these are all places where your immune system can be strengthened. Trauma is another big one in endometriosis. So I have a whole article on mind body healing from chronic pain. The way I identify if this is involved in someone's pathogenesis is if there's a certain event that happened and it feels like it might have occurred 2-3 years ago, but for you, the pain is so raw that it feels like it happened yesterday or today. That is something to address either with the therapist or through trying some of these exercises that I have on my website. So anyone with long-term chronic pain, it's important to be able to set up your lifestyle so that one day when you're no longer feeling pain, you can continue some of these healthy pieces that you've established. So I do questionnaires to see if patients are ready to live pain-free, and have people do exercises like writing a journal entry about their first pain-free period. I need people to be able to see that it's possible and it's happening. Another thing I might have people do is consider the role of the disease in their life. So for example, I am Madhuri's endometriosis and I have a job to let Madhuri take time to rest and relax, because I see a lot of women who are, for example, the eldest child in their family. They have been exposed to, stresses of taking care of everyone, and they never really got to take care of themselves until they got diagnosed with this condition, and they were able to get massage therapy, acupuncture, and do the self-care they needed to set up healing. They didn't have this disease, they didn't have a choice. They had to start those activities then. So I want to make sure you're able to have these activities in your life along your path of healing. So we are running short on time, so I will just try to storm through some of these adjunctive treatments. But yes, acupuncture is also involved in supporting your immune system and your ability to relax from chronic stressors, which are going to throw off your hormones. Things to keep in mind, depending on your symptoms, are pelvic physiotherapy, Mayan abdominal massage can all be helpful. And these are all adjunctive. Surgery is sometimes helpful in endometriosis. Wide excision surgery is especially a good consideration, and good surgeons will willingly share techniques and outcomes. I do help patients with homeopathy and certain supplements before and after surgery to help them heal. So with homeopathy, arnica is a nice healing remedy. I might consider something like Staphylococcus sagria for sharp pains, and the surgical incision site for helping that heal. So it's very patient specific, but it's important to still work with your naturopathic doctor in helping you get the best outcomes from surgery. And then conventionally, birth control and other hormone blocking medications are used. So it's important to have timeline known in that. I'm seeing birth control prescribed for women very young, having endometriosis as a way to preserve fertility. But something to keep in mind is that if you start birth control when you're very young and you're planning to be on it for 5 to 10 years, it does increase risks of certain types of cancer. And also it reduces your ability to accrue bone mass. So it affects how strong your bones are. So it's all about informed consent. Birth control can be a very helpful part of your treatment plan, but it's important to talk to your naturopathic doctor about supporting certain nutrient deficiencies if you're on the birth control pill, as well as helping prevent some of the liver and gallbladder side effects that we see with it.
Awesome.
Yeah, so
Yeah.
we welcome your questions. We're all very available in our different online platforms. So I call myself the EndoDoc on Instagram, and I love hearing from people. So don't hesitate to reach out.
Thank you so much. As you can tell, it's a very, very passionate topic of Dr. Shreya's, the EndoDoc, our very own. And certainly something I know that we all share is that passion for helping women reclaim their health and living pain-free, and, you know, addressing these symptoms that let their monthly cycle not be something that needs to take over the rest of their life. So yeah, we invite you to join our community. You can find our Instagrams here. If you haven't downloaded our Stress and Your Hormones free ebook, you can find the links to that on our Instagrams, and I'll also be posting it in my description on YouTube too. So take a look for that. Thank you so much for joining us, and we will see you guys next time.